So, let's set the scene. You're in Germany, something happens, and you find yourself needing medical help at a hospital. What are the words you absolutely have to know? Well, that's exactly what we're going to tackle today, the essential German vocabulary you need to get through a hospital visit with confidence.
Yeah, this is a scary thought, right? I mean, being in a hospital is stressful enough without having to worry about a language barrier. But don't worry, that's the exact problem we're here to solve. And we're not going to do it with some boring old vocab list. No way. To make these words really stick, we're going to learn 25 crucial terms by following a patient's journey, from the second the emergency happens all the way to when they get to go home. By putting every word into a story, you'll learn what it means and how to use it. It makes a world of difference.
Okay, so our story begins where a lot of hospital trips do, with an emergency. These first few moments are absolutely critical, and, so is the language that goes along with them. So what's the first thing that happens? A call goes out for der Krankenwagen. This is such a classic German compound noun. You've got Kranken, which means the sick, and Wagen, which is car or wagon. So a car for the sick, an ambulance. It makes perfect sense. That Krankenwagen then rushes our patient over to die Notaufnahme, the emergency department. And then once they're checked out, comes die Aufnahme, the official admission into the hospital. See? A very logical step-by-step process. All right, our patient is in the system. Now let's get our bearings and learn the words for the key people and places they're about to run into.
The main setting for our whole story is, of course, das Krankenhaus. Just like Krankenwagen, it's another one of those awesome compound words. Kranken for the sick and Haus for house. Literally a sick house. You gotta love how logical that is. A really common phrase you might hear is Ich arbeite im Krankenhaus, which just means I work in the hospital.
Okay, this slide shows something that is so important in German, gendered nouns for people. Check out the pattern here. On the left, you've got the masculine forms, der Arzt, der Krankenpfleger, and der Patient. Then on the right, you see the feminine forms, which often just add an in at the end, die Ärztin, die Krankenschwester, and die Patientin. Getting this right will make your German sound so much more natural.
So inside the Krankenhaus, patients stay on a specific station. Now, this is a helpful one because it sounds a lot like the English word station, right? But in this context, it means a hospital ward. Super easy to remember. You might hear someone give directions like, Die Station ist im dritten Stock, which means the ward is on the third floor.
And where on that station will our patient be? In their Patientenzimmer. And look, there's that logical German structure again. You've got Patientin, the patient's, and Zimmer, which means room, the patient's room. So simple, so direct, and so useful. Okay, our patient is all settled into their room. Now the real medical work can begin. Let's look at the vocabulary the team will use to figure out what's actually going on. This whole process really kicks off with die Untersuchung, the examination. This is the official word for when the doctors and nurses start asking questions, running tests, and just generally checking on the patient. A doctor might come in and say, Die Untersuchung beginnt jetzt. The examination is starting now. Now, during that Untersuchung, the patient has to explain how they feel. And these three words are incredibly useful. You have die Schmerzen for pain. It's plural because pain can be all over. Then there's das Fieber for fever, and die Wunde for a wound. Just knowing these three can make a huge, huge difference. Of course, an absolutely essential part of any checkup is taking the vital signs, and that includes der Blutdruck. That's your blood pressure, and the sentence you're always hoping to hear is Der Blutdruck ist normal. So after all of this work, the examination, talking about symptoms, checking vitals, it's all building towards one thing, die Diagnose, the diagnosis. This is that key moment when the medical team names the problem. Okay, so a diagnosis has been made. Now we can finally move on to the next chapter in our patient's story, the treatment plan and the journey back to feeling better. The overall game plan for getting better is called die Behandlung, or the treatment. This is really the big picture term that covers everything the doctors and nurses are going to do to help the patient, whether it's medicine, surgery, you name it. And that Behandlung can look like a lot of different things. This table shows 4 of the most common ones. It could be die Operation, which, by the way, is almost always shortened to just DOP. That's surgery. It'll probably include some das Medikament, or medication. You might need die Spritze, an injection,
or maybe der Verband, which is a bandage. 4 really key words for recovery right there. Now, sometimes things get a little complicated during recovery. A really common issue is die Infektion, an infection. This is another one of those words that's super similar to English, which makes it a lot easier to catch on to, especially if you're feeling stressed out. For really serious cases, a patient might need to be moved to die Intensivstation, the intensive care unit, or what we call the ICU. This is where patients get the most specialized round-the-clock care in the whole hospital. As our patient starts to get better, the doctor might write them das Rezept, a prescription. This is the piece of paper they'll need to take to the Apotheke, the pharmacy, to get their medicine after they leave the hospital. All right, our patient is finally feeling better. We're on the home stretch. It's time to wrap things up and learn the vocabulary for those last few administrative steps. You know, recovery doesn't always stop when you walk out the hospital doors. If a patient needs to see a specialist for more care, their doctor will give them die Überweisung, which is a referral. And that brings us to the final and probably most welcome step in this whole journey, the Entlassung, the discharge. This is the official release from the hospital. It's the moment our patient gets the green light to finally go home. And just like that, our patient's journey is complete. By following along with this story, you've learned 25 essential medical terms in a way that actually gives them context. And trust me, that makes them so much easier to remember. So now you've got the nouns down, the people, the places, the things. You've got the whole framework for a hospital visit. But to really make the story move, you need action words. Which brings us to a pretty important question. Are you ready for the verbs?
Thank you. Until next video, do like, share, and subscribe.